What causes delayed umbilical cord separation in babies? Have you ever wondered why some newborns take longer for their umbilical cord to fall off? It's a common concern for many new parents. Let's break down the reasons behind delayed umbilical cord separation in babies. Typically, the umbilical cord separates from a newborn's belly within about 1 to 2 weeks after birth, usually around 6 to 14 days. However, some babies experience delayed separation, which means the cord stump takes longer than 3 weeks to fall off. Several factors can contribute to this delay. First, immune system issues can play a role. The separation process relies on the immune system, especially white blood cells known as neutrophils. These cells help break down the tissue connecting the cord. If a baby has a low number of neutrophils, or if they do not function properly, the cord may take longer to separate. This can happen in certain immune conditions like alloimmune neutropenia. Infections or inflammation can also delay separation. If the area around the cord becomes infected, a condition known as omphalitis, it can slow down the process. However, it's important to note that infections are not always present when there is delayed separation. The method of delivery can influence the timing as well. Babies born by cesarean section often have a longer duration before the cord separates compared to those born vaginally. How you care for the umbilical cord stump can also affect how quickly it falls off. Keeping the stump clean and dry without applying any substances is known as dry care. This method helps the cord fall off sooner. On the other hand, frequent wetting or improper care can prolong the separation process. Another factor to consider is if the mother received antibiotics during labor. This can influence the time it takes for the cord to separate. Other factors such as the baby's birth weight, overall health, and even the season of birth can also play a part. As a millennial mother, understanding these causes can help you manage expectations and care routines. It's essential to keep the cord stump clean and dry, avoid unnecessary substances, and watch for signs of infection. Look out for redness, swelling, or any foul odor. While delayed separation can be concerning, it is often not linked to serious problems if the area appears healthy. However, if the cord remains attached beyond 3 weeks or shows signs of infection, it is advisable to consult a pediatrician. In summary, delayed umbilical cord separation is usually related to immune function, care practices, delivery factors, or mild infections. Proper care and monitoring can help ensure the cord separates safely and naturally.